No shirt, no shoes? No problem. Come as you are. Alternative Talk, 1150 a.m.
Welcome back to the Susan Harmon Hour. That was great, Eric.
Yeah, that's the luck of the Irish from John Lennon. If just in celebration or in celebration of Irishness in general, since St. Patrick's Day, which you don't celebrate, is coming up. But we can honor our mutual Irish heritage, right?
We can, and
All right.
I do celebrate the pre-St. Patty days, which is why I like the band U2 so much. They are so pre-St. Patty, they're like...
I'm not sure they had delay pedals before St. Patrick, but
no, that was sweet. That was really sweet. Well, a non-Irishman is here with us, but on St. Patrick's Day, everybody is Irish,
right?
Yes, that's true.
Yeah. Welcome, Dr. Sodhi. I appreciate so much you coming to share all of this with us that you do. I mean, I know that in your veterinary practice that you use herbs, homeopathy, acupuncture, and a lot of other things. What got you started?
I think it's a very long story. When I came to the United States, I do come from the background where conventional veterinary medicine and human medicine is always complemented by local Indian traditional medicine, which is in Ayurveda. There's a lot of homeopathy. When I was doing my residency and internships at the group, and my seniors and my mentors was always challenging me to say, what would you do if you were in India about this thing? This is a dead-end case with a bad liver thing. What would you do? And I will say, I have some alternatives with herbs. So when I started my own practices and I called my mentors to see, one thing, to seek their blessing and also see guidelines to see what will make me successful. And one of my mentors, Dr. Don Canfield, he says, Tejinder, you do best what you do is you have a lot to offer. Why don't you practice what you believe in? And that's all it started with. And it was a brand new avenue for me because we all are trained traditional, but I wanted to expand and learn more about it, and it's been a quest since then, and I've been learning since ever.
Well, you're pretty modest because I have looked at all the things you've done. I mean, you continually study. You're always starting something new. You've founded organizations.
Well, like I said, learning is always there, though. Whether it's you go to a curriculum or you go to school or you learn from your client or a patient. So it's a never-ending phenomena, which we do every day, and we grow from there.
Yeah, when I was a kid, I had wanted to be a vet, but I couldn't figure out how, being an empath, it was really hard for me because I could feel what they were feeling, but I didn't know how to communicate. At age 14, you don't have it all down with you. So when you're communicating, I know you get information from a pet owner on what's going on, just as you would from another family member with a child or something, or even someone my age, another family member would say to the doctor, blah, blah, blah. But what are the clues that you get, say, from a dog?
Well, a lot of times, most clients are pretty much tuned into their family pets or their kids, I call them.
Yeah.
And that helps to prioritize and isolate and get down to the differential diagnosis. But there are a lot of times when we get very vague history. What did the dog eat? I don't know. Where was the dog out? I don't know. Who was out there? I was gone for 8 hours, 9 hours, came home to find my dog not doing well, was fine in the morning. So I think all starts with a good physical exam and trying to put the clues together. And sometimes you have to rely on the diagnostics. You may or may not immediately click to find out the solution. But as long as you do follow the general diagnostic tools, good relevant history, I think you should be able to get to the point where you need to get to.
Talk a little bit about the science of life. I know that you started in India.
Mm-hmm.
Explain to people what that means.
Well, I think you're trying to refer to Ayurveda, which is a traditional system of Indian medicine. And supposedly, and I believe in it, that is probably the oldest system of healing. It believes in your lifestyle based on 5 basic elements, and ultimately those 5 elements are transferred into different manifestations of the body, which takes to different body types. And people have probably heard about Vata, Pitta, Kapha type bodies, and it's just manifests into different bodies, body constitution type, body types, body different metabolic activities, and then you, based on those body types, you draw into a lifestyle which helps you to balance life. So it's all about prevention and making the life happen, not trying to cure the disease when it's already happened.
Yes.
And it's very expanded course. It's taught still in it there. There's a 5 to 6 year schooling after pre-med courses in the universities. And there are universities which are doing research and postdoctoral researches in India still.
So you're bringing that here to the United States. I know that there are now more other veterinarians who, are interested and are developing these kinds of practices as well. You did start a Washington State Veterinary Medical Association, and the
holistic chapter of it.
Holistic chapter, and I think that that's really important for people to know that there are holistic veterinarians in the state of Washington.
I think we felt the need that we needed a holistic chapter because originally there was 1 or 2 pioneer veterinarians who were doing it. Dr. Michael Lemon Renton, who is basically semi-retired now, and I was the second one in the state of Washington to do holistic medicine. And we encountered that a lot of my clients who believe in holistic medicine could not find any other help if it was after hours type of things, or if I did something and it was a weekend, they end up in an ER or an emergency, and these doctors will pretty much blow them away. You're doing what? Homeopathy? What is that?
Right.
And I felt a need that I should be more active in trying to educate my own peers rather than trying to educate every single body. I can educate my peers and go and talk to them. So I went in front of Seattle King County VMA, represented myself as a person who does holistic medicine, and they ask me questions and say why and what I will do with it. And it says, you guys know I'm a licensed veterinarian. I've been a member in good standing, and can I start a chapter of holistic medicine? And there's a naturopathy. At that time was the John Bastyr College, which is now Bastyr University, and I told them, the state of Washington has a naturopathic doctors here, and it's a licensed entity here. And so they were very open to it. After a few minutes of discussion, there was a handshake, and I became a part of Seattle King County, Washington VMA holistic chapter member.
Now, were you anticipating that that they would be open, or were you not sure what the response would be?
Well, I think what we started is the dialogue with the members before I went in front of the board. And we've been trying to talk to them and say, hey, acupuncture is well accepted in traditional medicine, and there are some herbs which is accepted very well, and homeopathy. So I think at the end there was not too many skeptics, but they wanted me to be there and feel comfortable with them. So that's the reason I went in there. And then we started our holistic chapter. Then we started to ask like-minded veterinarians who believed in the similar things. And I used to host them in my clinic with a dinner or something and bring a speaker. And ultimately it led to the formation of Washington State Holistic Veterinary Medical Association chapter.
Great. And I want to ask about more specific cases that you've had, something that people can relate to. After we come back from break, we're going to take a short break. And you are listening to the Susan Harmon Hour on Alternative Talk AM 1150.
Intuitive empowerment coach and healer Tara Carell will help you gain clarity and confidence through soul life readings, spiritual energy dynamics, and Reiki. Tara will support you throughout your transformation in becoming your most brilliant, while offering clear insight to questions of life, business, and love. Experience peace and fulfillment. Uncover your path and soul's true purpose. Contact Tara at 206-851-9627 for a complimentary consultation or to schedule your session today. Visit taracarell.com. That's TARACORRELL.com.
On Friday, Manson Mitchell welcomed Reverend Michael Bogar, who answers how we got to being spiritual but not so religious today.
On Saturday, Robert Moss reveals what he experienced when he had 3 near-death experiences.
Then Atlanta's Reese Christian talks about her work as a medium and psychic detective, assisting with law enforcement.
Manson Mitchell, Friday and Saturday mornings at 10, right here on Alternative Talk AM 1150.
Are you feeling stressed out, not knowing how to cope with the tensions of work, home, school, or challenging life situations? Becoming Your Own Therapist is the workshop that will save the day. Finding peace of mind creates abundance, health, and loving relationships. Sharing evolutionary tools for transformation not only reduces your stress, but you'll learn to be the master in control of your life. Join us on Saturday, March 22nd, 9:30 a.m. to 3:30 p.m. at Home Task in Burien. 206-293-1241. That's 206-293-1241. Or visit unzipyourrealself.com. That's unzipyourrealself.com for more information.
Independent programs, independent voices, independent ideas. Alternative Talk, 1150 AM.
You're listening to the Susan Harmon Hour on Alternative Talk AM 1150, and I am here with Dr. Sodhi today. We are discussing veterinarian medicine, holistic health for the other family members that are non-human, because they are our family members, and we do care. I mean, I care about wolves, but I care about my cat, my cat Arthur, the Pampered Prince, is 21. And he's a champion sleeper. He's in training most of the time. You know?
They are part of the family. In fact, for our intake forms, we have changed the name of the owners to the guardians and parents now. So.
Yeah, I think that's perfect. You know, Dr. Sodhi, I know that you have 2 clinics, one in Lynnwood and one in Bellevue. And I wanted to just give our audience a heads up on going to your website, www.holistic-pet-care.com. www.holistic-pet-care.com. And you can get more information about how you can connect there with Dr. Sodhi. And I'm pretty sure they could go online and find out more about, if they're not right in those areas, other veterinarians who are doing the same kind of work.
Definitely. We are quite a few veterinarians right now doing acupuncture, few groups doing more than one modality of holistic medicines. And I have 2 locations, one in Lynnwood called Animal Hospital of Lynnwood, and in Bellevue, which is Animal Wellness and Rehab Center. So people can look for that, and they can also Google my name to find who I am.
Well, that's actually how I found you, was through a friend. And, of course, you and I both know that word of mouth is the most important thing, that, you know, that's where his dog is happiest, is under your care. And I think we need to know that I once years ago took a cat to a vet who was like slamming it around on the examining table, and I picked my cat up and left.
No, that's
like,
unfortunate.
Oh.
No, that's unfortunate. Yeah.
You know, cats, they're independent critters.
Well, definitely. I think the handling of animals depends on basically how quiet and calm the environment and what kind of reservations you have before you go into it, and how you present themselves to the animal. They can read into your pheromones and body language.
Absolutely.
So if you are nervous, they already are nervous, they will be more anxious. And I heard you about the fear and anger, and it correlates where we started with.
Doesn't it?
That's right.
It absolutely does, because they can pick up on your anxiety, on your fears, and all of that, because we send those smells out.
Well, again, like that, if you understand where they're coming from, talking to them into politely, getting at their level, you can open up a lot of channels and a lot of healing.
Yeah, and I myself have done healing work on animals energetically. I'm not a veterinarian by any means. I would never presume to do that, and I don't think that energetic work accomplishes everything that the animal needs by any means. Well, I think that you need other things.
Yeah, if you can calm them down, then I think you achieved the goal, and the rest is what you could offer to do at home. I always tell my clients that, it's 5 minutes of my time talking to you, or maybe 20 minutes of my time talking to you. The rest of the healing is happening at home. So as a pet parent, you're doing a lot more.
Well, I had a woman that brought her dog, to my healing room, and she was so nervous. She'd taken him so many, and so this little dog is like freaking because he's like, oh God, one more person's going to probe me,
That's right.
And I got him on my little massage table inside my pyramid, and I just waited. I let him walk around first, all around, let him smell out the place, see what, check it out, see how it feels to you.
Gentle pets, little massage in the back, see how easily they melt in front of you.
Absolutely. And once he did, he laid down on the table in the pyramid and just went, he was fine then.
Yep.
Because he knew that it was a safe space. And I think that all of us, whether we have 2 legs, 4 legs, 6 legs, 8 legs, no legs, we want to feel like we're in a safe space.
That's right.
And so, maybe you can share some experience that you had that really impacted on you in terms of working with the furry folks.
Generally speaking, the way my practice has evolved right now, we are seeing a lot of geriatric chronic cases, dead-end cases. Mm-hmm. And it's sad that a lot of these people could have started a lot differently if they have done it early.
Right.
And I am faced with the dilemma that, my dog is dying with the cancer-ridden situation right now. Can you save my dog? And at the end, we always tell cancer wins or the disease wins, but can we buy a quality of time or quality of life, which I can help you with it? I'm not opposed to the fact that sometimes choices has to be made. The second dilemma we face is that, okay, we have done so much expense in this diagnostics. We have onto thousands of dollars into this dog's treatment, and I'm left with only one check in my pocket. Can you fix my dog?
Yeah.
Wish we could do all that way, where I could say, yeah, we can do it with the $120 paycheck, or that. Things do take time and money, but there are things which could be discussed and dealt more naturally, make comfortable. I'm very lucky to deal with a lot of specialty groups here who do the cancer treatment on their hand, and they still send their clients to me for nutritional consult because they think it's a valid science. I deal with a lot of neurosurgeons who do neurology surgeries here and send their clients for me to do a rehab and acupuncture because they know they've done their job. Good neurological surgery does not mean good neurological outcome or better outcome, and they know there's something needs to be done. We have recently a few cases where shoulder was bad on this dog, and they had done 2-3 surgeries, and at the end of this rope, it takes a lot for a surgeon to say, I've done this many surgeries. I can't do more than what I can do.
Right.
Maybe go to Dr. Sodhi. And there are cases where, internal medicine cases, the dog was born with a very limited function on the kidneys, was barely 8-9 months old. I was told basic, I don't know anything, go to Dr. Sodhi. Maybe he has something in the diet or modification.
So how did you handle that?
Well, basically, we did a diet modification. We have herbal supplements. And strangely enough, and fortunately enough for the dog and the doggy parents, the dog lived to be about 12, 13 years of age.
Fantastic, because you changed some dietary.
And it's amazing what it have done.
Would that we could translate some of the things that you and your fellow veterinarians are doing to the human doctors, because they're not sending their cancer patients for nutrition and acupuncture like I think they should be.
Well, like I say, it's ever evolving, and I think human medicine is getting there. We can't fix everything and we can't treat everything, but at least when we focus on quality of life, as long as we don't compromise quality of life and we could keep these animals comfortable, healing starts to happen.
That's true. I do think that the people that work with non-humans in healing do pave the way. Abusers, we made laws to protect animals before we made laws to protect children. And you do see that if somebody is abusive towards an animal, that is really showing you that they're abusive towards the children as well.
That's true, and I know of an example of a client who wanted to adopt a kitty cat from a shelter. He could not adopt a cat, but he could adopt a kid.
Well, I also
that was his point, that I could adopt a kid, but they would not give me a dog because I do not have a backyard fenced in. I said, they have a valid point.
Yeah. I mean, it's like, well, I've had people say, well, why don't you get a dog? And I said, because I'm too lazy. I mean, a dog has to be walked, whether you feel like it or not.
It's a brand new kid in the house.
Yeah, I mean, they take a lot of care. And I am not going to take an animal and leave them locked in the house all day. I don't like the idea of the carting thing that they do, of putting the dogs into locking them up in a little stifled place. If you have it where they can go in and out, and they have this little place that's a cubby hole that they enjoy, that's fine. But when they're locked up all day while you're gone.
Well, that's most of the shelter returns are behavior problem because people don't have enough time or space.
Exactly.
And all the behavior problems do arise because of the fact they did not have enough activity during the day.
Yeah, and I think that you really need to make honest decisions about what you can and cannot do in your life. I mean, I love dogs. If I was living in the country, I would have a dog again.
That's true.
But I'm not going to do it now because, like I said, I'm too lazy. My cat's fine. He's like, yeah, fine. If I had a thumb, I wouldn't need you at all. I could run the can opener myself. So
yeah, cats are more independent than dogs are.
Yeah, they're so independent. I've referred to him on occasion as the furry alarm clock. I get up, open
that
a
never
can.
fails. Their clock never fails.
Yeah. So they're. Do you treat other animals besides dogs and cats?
Primarily every animal with the fur and what we call pocket pets. I do see bunnies. I do see ferrets, chinchillas, hamsters, guinea pigs, and a lot of hedgehogs.
I didn't even know we had a hedgehog, overpopulation.
Right. Well, people who are probably seek them out. So I don't do birds or snakes, but pretty much all small animals.
That's cool, hedgehogs. I don't know. There's something in my mind that they just seem. I guess it's Alice in Wonderland. I like the hedgehogs.
They are hard to examine, but no, we do it.
Are they really?
Well, a lot of them curl up, but I've seen hedgehogs where they have treated them as a family member. They put them in their palm of hand, and they can open up for you and examine it. Lately, I've been very lucky that I not have a hissing hedgehog or rolled up ball of hedgehog.
a rolled up hedgehog. Well, we're going to take a short break, and then we're going to come back and finish up with Dr. Sodhi. I have just been having such a great time. You are listening to the Susan Harmon Hour on Alternative Talk AM 1150.
The Emerald Spiral Spring Expo is coming Saturday, March 29th at the Kent Commons, 525 4th Avenue North in Kent. This is the largest metaphysical gathering in the Northwest, from tarot to Tibetan clothes, from astrology to art, from crystals to energy workers. The Emerald Spiral Spring Expo has it all, including free parking and free admission, and free speakers, plus fantastic hourly door prizes. Why not make a day of it? Between a reading and getting that perfect pair of earrings, stop by the snack bar for a terrific selection of refreshments. Go to emeraldspiral.com. That's emeraldspiral.com. Or call 206-508-1270 for more information.
Intuitive empowerment coach and healer Tara Carell will help you gain clarity and confidence through soul life readings, spiritual energy dynamics, and Reiki. Tara will support you throughout your transformation in becoming your most brilliant, while offering clear insight to questions of life, business, and love. Experience peace and fulfillment. Uncover your path and soul's true purpose. Contact Tara at 206-851-9627 for a complimentary consultation or to schedule your session today. Visit taracorrell.com. That's TARACORRELL.com.
In honor of launching the Susan Harmon Hour, Shamanic Arts is offering KKNW listeners a 25% discount off any stone or crystal simply by calling 206-937-2779 for an appointment and leaving the message, I love KKNW and the Susan Harmon Hour.
Are you feeling stressed out, not knowing how to cope with the tensions of work, home, school, or challenging life situations? Becoming Your Own Therapist is the workshop that will save the day. Finding peace of mind creates abundance, health, and loving relationships. Sharing evolutionary tools for transformation not only reduces your stress, but you'll learn to be the master in control of your life. Join us on Saturday, March 22nd, 9:30 a.m. to 3:30 p.m. at Home Task in Burien. 206-293-1241. That's 206-293-1241. Or visit unzipyourrealself.com. That's unzipyourrealself.com for more information.
There's nothing else like it on the dial. Alternative Talk, 1150 a.m.
And I am not taking a walk with the dog because
he's non-existent.
Because he's non-existent. But you're listening to the Susan Harmon Hour on Alternative Talk AM 1150. I'm here with Dr. Sodhi. We've been having a really good time. It's very interesting, the work that you're doing, and I'm so excited and pleased that the veterinarian community is, responding in such a positive way. And I think it's taking care of our animal pets. In the city of Seattle, there are more people who have dogs than have children.
That's true.
And so, this area I think is prime for understanding. There's a whole aisle at the grocery store for pet supplies. And what's interesting to me is I found I have an older cat. It's 21.
Wow.
That's not young. I had, for some time in the past, I had gotten him the senior food. What they don't tell you is they do that senior food for them to not gain weight. And he was getting a little thin. And when I went into the pet supply store instead of the grocery store, they said, well, was I feeding him the senior food? And I said, yes. He said, well, that can be a problem because it's designed for them to lose weight. And with his, being older and all at his age. So what we did was we did the adult food mixed with the kitten food on the crunchies.
I will cautiously warn you. There could be a lot of conditions in geriatric patients where the diet switch should be only done in consultation with your veterinarian.
Right.
And based on the blood work. There has been a lot of push about high-protein diets in the geriatric patients, and the jury's out there. The geriatric dogs and cats cannot handle puppy and kitten foods. So there could have been a lot of other...
But he did put some weight back on.
Well, that's good, though.
And so the vet was happy with that.
Yeah, generally I will have drawn based on the blood work done and to find out the body functions were fine, the kitty was not hyperthyroid or any other issues to be causing the weight loss. I know the diet could lead to the weight loss if it's not right, nutritionally balanced. But I would have done it based on some veterinarian's recommendation rather than a store person or pet store person. Yeah.
Right, but you have to consider the majority of people are buying pet food at the Safeway.
Well, I agree. And at the same time, a lot of people buy what we tell them when they go to pet stores, and the pet store people pretty much wipe out their brains and tell them what they need to sell them.
Yeah. Well, I can say this is not the case in this particular one because she
knew stuff.
Yeah, she really did, and the vet did concur with her. But I do agree with you. They'll try to. There's a pet store I won't go to because they are,
They want to promote their stuff.
Yeah. Exactly. They don't care, and they talk bad about everyone who's not doing exactly what they're doing. Is there anything that you want to leave the audience with? Is there anything that is super important for you to get out there?
I think one thing to take home and a simple message is that looking for your options and explore more options. We do all train as a traditional veterinarians. We do surgeries. We do diet consults. We talk about vaccinations. But at one point or another in life, when you're stuck with the choices of dealing with dogs with the certain medications which could be harmful, or where you are stuck at the dead end, is there any other alternatives? If your dog is arthritic, do I want to put him on harmful non-steroidal anti-inflammatory drugs or pain medications which could make your dog sleepy and dopey and groggy? Or can I look for acupuncture? Can I look for hydrotherapy? Can I look for the herbal supplements? And jury's out there. We see a lot of patients, and certain days we see 15 to 20 acupunctures a day. And these people come in because there's no placebo effect. You can't tell the docs to feel better because I gave you a pill. If you do an acupuncture and if they feel better, clients do come back. So I think one thing to take home is looking for your, in a way that, are there any other options which could be more acceptable and a lot less harmful for my animals?
Well, I'll tell you what, I can't imagine anything better for people to know. And I think I'm going to just one more time say that they can find you at www.holistic-pet-care.com. They can get a lot more information on how the furry members of their family can be taken care of. And there's just so much. I do see a link between, if you love your pets, you can extend that out into the world to other life forms as well. I
tell my clients that how we treat our animals or pets is just like how we want to be treated. So,
and isn't that the basis? We talked earlier about someone being Catholic saying I can't work with you because you have a different religion, kind of thing. But every single religion at its core says treat other people the way you want to be treated.
That's right, and it's a reflection of you.
Exactly. If I look at you and I see God reflected back at me, then I'm seeing your true self, and you're seeing truly me too. I mean, we have to do that.
That's very true. It's a mutual respect, and I think it leads to a lot.
Yeah, and I've always said I get along great with animals. And children. It's adult human beings that
we have our own boundaries and
that are like, oh, I can't deal with that. So when we start really walking our talk and being in truth, I think a lot of things shift for all of us. You are a man of high integrity, and I really want to thank you for taking the time to come and share your knowledge with our audience today.
Thank you. It was my honor. Thank you for having me here.
So nice. Dr. Sodhi, I appreciate that, and thank you for being with us. Next week, we have a very, very old dear friend of mine coming via the phone because she's in Dallas. Her name is Donna Lynn, and Donna is an esoteric numerologist, among other things. She's written 3 books, Breaking the Code. It's an esoteric study of numbers and their meanings, and Beyond the Code, using sacred geometric designs. Inside the Code is her new book, which will be out this fall, and it's a historical look at the I Ching and patterns within the hexagrams. One of the things that I have found interesting is the geometric use of patterns impacts on all of us. There's some things that just sort of why the mandalas are so important, why the Tibetan sand pictures, why the fairy stones that the First Nations people took, because the patterns were formed in the stones. All of these patterns that we see, the sacred geometry, does impact on us and our lives. It keys things in. If you know that the triangle is the key to third-dimensional language, it just really makes a huge opening for us, and that's what we all need. I'd like to ask a blessing today on everyone that is listening, the 4-leggeds, the 2-leggeds, the 6-leggeds, the 8-leggeds, those that fly, those that crawl, those that walk, those that we cannot see because they're too small, and those the plants and all the life that is teeming. You can just feel the earth pulsing, and the blessing that we have living here in this life is just wonderful. Go forth and love each other. This has been a wonderful day. Thank you, Eric, for everything you do. We'll be back next Friday at noon with Donna Lynn. And have a fantastic day, a fabulous weekend. And be sure to stay tuned to Alternative Talk, AM 1150.